So my name's Evelyn Kwamboka Simba. Yeah, I'm a nurse by profession, and I work here. So feel most welcomed. Feel free to ask questions. And today we are going to, I think I'll go straight to the topic. You know our topic today?
Yeah.
You know?
Yes.
He knows.
Umepatiwa trailer.
Umepatiwa?
Yeah, family planning.
Family planning. Yeah. So today we are going to discuss about family planning, and I think it's going to be an interactive session so that people don't doze off. Sindio? Yeah. So how many are 18 years and above? All of you? How old are you? How old are you? 16? For real? How many are in high school? High school? So all of you are, at a sweet 16, you are above. Umemaliza form 4?
I'm not 16.
You are how old?
I'm 20.
Ah, okay. So all of you are doing these things, you know? Yeah. So it's good that you have a know-how of how to plan. Even men, there's a way you can help your women to plan, you know? So I think I will go straight, and then after we are done, we'll ask questions. So I will start with what is family planning? You can give me a clue. What is family planning? The methods I will teach you, but family planning, everybody knows what is family planning. What is your name? This one? In what?
Mercy.
Mercy, what is your name? What is your family planning, sorry?
Family planning, I think.
Mm.
So not I think. According to my knowledge, it's a way in which you prevent unplanned pregnancies, early pregnancies. Yeah. Kind of.
Yeah. Another person? It's regulating the number of pregnancies and deciding to have babies, the number of babies you can comfortably take care of. So a person can have 5 babies and na amefanya family planning and is able to take care of those children comfortably. Another one can have 2, another one can have 10. As long as you are able to take care of those children comfortably and you are spacing them well, then that is, I think, majorly in family planning, now we focus on avoiding unwanted pregnancy, ensuring we bring about wanted birth, and regulating the intervals between pregnancies. That is the aim, or rather that is part of the definition of family planning. So we are aiming at avoiding unwanted pregnancy, bringing about wanted babies, and regulating the interval between the pregnancies. So in family planning, we ensure that there is proper spacing, proper timing, and having the number of babies you want to have. If you want to have 3 babies with an interval of 5, 5, 5, that is what we ensure, so that if when you are a girl, before you get married, there are those dreams, like I want my firstborn in 2025, my secondborn 2030, but when you enter there, you may get 2025 another one, 2026 another one, 2027 another one. Senior? Yeah, so those are the things. We ensure that the intervals between the pregnancies are as per the couple's wish. So there are the advantages of family planning. We can't advocate for family planning if there were no advantages. So one is that it reduces health risks to the mother, because you understand that once a mother is pregnant, there are a lot of psychological and physiological changes that take place inside the body of a woman. There are nutritional effects. There are pregnancies also, they come with complications. So when you space, the mother is able to regain. After one pregnancy, the mother regains fully, returns to their normal health before they are able to get another pregnancy. Ukiangalia, like those who have gotten pregnant, after every year they are very pregnant. After like 5 years, he has 3 babies. Those mothers, they don't look very healthy because they have drained their nutritionally, because the babies, they are breastfeeding, they need their attention themselves, they need to be there. So you get health-wise, it's going down. So one is to reduce the health risk of the mother. Another one, the physical strain of childbearing. Labor is not something that is easier. So you want to cry this year, you cry next year, you cry the other year. It will reach a point whereby you will see like it's a burden. Others will say, I don't want to get a baby because whatever they have gone through is not good. Another one is to reduce the maternal deaths. There are those women who die due to complications during pregnancy. So when you space, it helps. Another one is to reduce the risk of ovarian cyst. We also have benefits of family planning to the children. It ensures better chances of survival. Another one is promotes better childhood nutrition, because the baby is able to breastfeed. For how long should a child breastfeed? Exclusively?
6 months.
6 months. Then after that, that is exclusive. Exclusive means you don't give foods. The child, milk contains all the components of all the food elements, proteins, fats, water, everything. So when we say exclusive breastfeeding, it means the child is going to breastfeed without external foods for 6 months. Yeah. With the food for how long?
3 years.
3 years. Another one? Another one? 2 years. 2.5, I think, is good. So it promotes the health of the baby. And another one, it promotes physical growth and development of the children, because they have ample time to grow, to bond with the mother, to breastfeed before you get another one. But if you get pregnant this year, next year, the first baby has to stop breastfeeding so that you breastfeed this one. So you could have denied this one a chance. Yeah. So it also has benefits to the father. And it allows the father to keep a constant balance between their physical, mental, and social well-being of the family. Now, the father is able to plan. Like, now I have one child, so he's able to know the needs of this child. So before they go and before he starts thinking of another one, he has to pull up his socks, because he has to know this one comes with an extra cost. So it helps him to also plan and to also keep a balance between the physical, the mental, and the social. It also increases the father's sense of respect, because he's able to provide the type of education and home environment to the family. Because if you get your firstborn and you are living in a single room, and now you are going to get your 50th born, will you still be living in that single room? Because in Amanisha, you will be sleeping with all your babies, and by then your firstborn could be 8 years. So you sleep with your wife, the 8 years, the 6th year, the 4th year child. You see, it doesn't make sense. So it helps the father to also plan. So if you want 7 babies, by the time the 6th baby is coming, you should be owning your own house. At least a 3-bedroom house, and you should be able to be taking care of them. So now we'll go straight to the types of family planning, and they are divided into majorly 4. We have short-acting and long-acting. Long-acting are those methods that can take over 1 year. Short-acting are those that can take 1 day, like pills, which you take daily. So all these methods, whether short or long, are divided into 4. 1, we have natural methods. 2, we have barrier methods. 3, we have hormonal methods. 4, we have permanent or surgical methods. Are we together? Girls, are you getting me? Yeah. So we'll start with the natural methods. Anybody who knows? Sisi wote ni above 18.
Pull out.
Pull out. It's called withdrawal. Yeah.
Ngori.
Hiyo ni ngori. It's called coitus interruptus. Coitus interruptus, or withdrawal method. This is a method, it's a natural method of family planning because there are no chemicals involved. You only talk with your husband and your wife and you agree. So we'll start with the one she has said. In coitus interruptus, this is a method whereby you as a couple, you sit down, you talk, because it needs mature minds. It works like this. Once you are having that thing, once you are having sex, you guys are shy?
No.
You're not shy? Yeah. So once you're shy? So once you are having sex and the man is almost ejaculating, so the man pulls out and he ejaculates outside. That is why it's called coitus interruptus. Coitus is sex, interruptus is interrupting the process. The man does not ejaculate inside there. Yes. And when that happens, it means that the man is not going to release the sperms inside the vagina. Therefore, fertilization is not going to take place. Though this method is not normally advocated if both parties do not cooperate. During that process, that sexual activity, in fact, during orgasm, is when you find that the man is into what?
Una climax.
Yeah, una climax. So pulling out becomes a problem. Yeah. So it needs really, it needs too much cooperation. In fact, it needs 100% cooperation. Because if you don't cooperate, and the moment this man ejaculates inside, it means you are going to get pregnant, and you do not want that pregnancy. So it needs mature minds, it needs cooperation, or parties to participate. Namkumbusha. Yeah. And this one, if you are unable to do it, there are some exercises which you can do prior, so that you prepare your thing to hold and release, so that during that time you can even hold, then you withdraw. Otherwise, you don't do that, you will get pregnant. Another method is called the cervical mucus method. This one normally is for the females. It involves observing the cervical mucus daily, so that you know how it changes. Like before ovulation, it's very thin. Yeah. Mucus method. Normally, yeah, the 7 days. No, it deals the 7 days. It deals with the cervical mucus, whereby the woman is supposed to monitor the mucus discharge from day one. When you start your period, that's the day one of your menstrual period to the end of the cycle. So if you have a 28-day cycle, then you monitor it throughout the cycle. You will know when you are nearing ovulation, normally the mucus are very thin, because that is when your fertile period is very high. So when you monitor the mucus, then you are able to know when it changes. So when it changes, you know when you are safe and when you are not safe. But it's also a very hard method, because most of the ladies, you find they are not very keen. Yeah, and they may confuse. For example, if you have candida, the mucus may change, become thick, and you may think that you are safe and you are not safe. So another method that is natural is called lactation amenorrhea method. This one is normally used by women who have just given birth, and they practice exclusive breastfeeding. If you give birth and you don't practice exclusive breastfeeding, then this method is not going to work, because when you practice exclusive breastfeeding, it means that your progestin levels in the body are going to be very low. Therefore, conceiving is going to be very hard. But if you are not going to practice exclusive breastfeeding, it means this baby is just going to breastfeed occasionally. And when the baby is going to breastfeed occasionally, it therefore means your body is not fully engaged in the baby. Therefore, the progestin in the body will be very kidogo. So you will have a baby, you go give some foods as you breastfeed, and then you have sex, and then you assume that you are breastfeeding exclusively, you will get pregnant. Ushawaiona mtu amezana after 3 months akona mimba, si ndio? So this one, if you have to use this one, lactation amenorrhea, you have to exclusively breastfeed the baby, be with the baby for the 6 months, no other meal. That is when it can work. Another method that is natural is called rhythm or calendar method, the save days. We normally say during the menstrual cycle, from day 1, we have different types of menstrual cycle. There are those who have 21-day cycle, there are those who have 28-day cycle, there are those who have 35-day cycle. For this one, you have to know your cycle. If you don't know it, you don't practice it because it will fail you. And for a boy, you also have to know. So that if you are going to feast your girlfriend, you know when she's safe. You just don't rush. From day 1 to day 7 for a 28-year-old cycle is safe. From day 8 to day 15, those are the fertile period. But the peak is day 14. That is when ovulation takes place. But we normally advocate that you don't have sex during this period because that is when the ova is moving from the ovary through the fallopian tube. You know where fertilization takes place? Yes. So during this time, if you have sex and the ova has not reached the uterus, you will be pregnant. So, yeah. Then from day 18 to upwards, those are also safe days because during this time ovulation has already taken place. But this method is only safe if you have observed your cycle for at least 3 months and you are very sure that you have a 28-day cycle. For example, if you want to observe your menses like this month, you have rolled after 24th day. The second month you have rolled after 28 days. The third month you have rolled after the 20th day. Do you know when you are safe? No. Do you know when ovulation is going to take place? No. So you don't practice it unless you are very sure that this is my safe days, this is my cycle, because you count. Because if you have a 21-day cycle, then it means by day 6 you may conceive. If you have a 35-day cycle, then by day 13 is when you may conceive. You get? And normally these natural methods, nowadays we really don't advocate for them because they have a failure rate of above 50%, meaning if 10 people are practicing these natural family planning methods, 5 will get pregnant. Sawa? Yeah, so tunazisema tu, but normally nowadays we say if you are using it, you use it in combination with another method. So next we move to the barrier methods. Barrier methods, anybody who knows barrier method 1? You know. Wapi Masi? Barrier method, sema moja.
Is it the one that they say it's copper or something?
Copper, no. Barrier 1 is condom. This is where you use, can I call them what? Barriers to prevent pregnancy. For example, a condom. That is the first one. We also have a diaphragm. This is an equipment normally which is inserted inside the females, but nowadays it's not very common. We also have something called a cervical cap. It's also like it's like a cap also inserted inside the cervix of the female. But these methods are not common. The one that is commonest is the condom. And in condom we have two. We have the male and the female. So you know them. Normally people know the male. Who doesn't know the male condom? Who doesn't know how it's used? Yeah, we know how it's used. We know how to dispose it. We know. The problem is the female condom. How many have seen the female condom? So we know it. The female condom, normally, most of the females don't know, but it's there. The female condom is there. It's the texture is like the male condom, but it's a bit long. So how it is inserted is that before you have sex, you have prepared yourself. The woman is now ready. She inserts it herself. Sawa. You take the condom, you peel off just like the male condom, and insert ndani. So when it's made in such a way that once it's inserted inside, the ending falls up to the labia majora and minora. Hizo vifuniko za wanawake. So inaka hapo. That's how it works. Such that when the man penetrates, it doesn't enter with it inside. And after sex, now the woman holds it hapo nje, anaifuruta, pulls it off and disposes. In fact, the hardest part is inserting it. Once it's inserted, the rest is just like the other male condom. You pull it off after it's done, you dispose it. It looks, the female external genitalia. You know how it looks. So once you insert it inside, the opening, so it's like a rubber, it wraps itself around the vulva, the female external genitalia, so that after sex, this is where you hold and pull it off. If you don't put it to wrap outside here, it means when the man is penetrating, is likely to go with it inside. Si itaingia kwa hiyo shimo, it will coil inside and enter with it, which means you've not done family planning, you've not protected yourself. It's just like the male condom. The man puts it on, enters with the condom inside. This one, you have yours inside. It's the man who has no protection. So he's the one who is entering. You are protected. He should not touch you, remember? Senior. See, they shouldn't be, if there is contact between him and you, then it means you have not used family planning. You are getting me? You are getting, ni kama kuingia ndani ya karatasi. So the advantages of this is that it is a very simple method. It has no side effects. It is easily available. It's not expensive, and it also protects against sexually transmitted diseases. Disadvantages is that it can slip off and tear, especially this female condom. If you are not keen with it, it will slip off. Because the man will wrap, and finally will sleep with it inside. Sindio? Yeah. So if you are not very careful, it will slip off. It can also tear. And don't make a mistake of putting two. You put two, it's like you are unprotected, because those two, they wrap against each other and they peel off. One per shot. Then the failure rate is 16%. That is if it's torn, you use like a torn condom and you don't realize it. The disadvantages with the female condom is that it's very expensive, and I think that is the major disadvantage, and most of the people don't know about it. The best advantages with the condom is that you don't need the instructions of a nurse. You don't need a healthcare practitioner. When you guys go to buy a condom, do you consult a doctor? You just go to the chemist, you get one. Those are the advantages. And they are easily available, they are easy to use, they have no side effects. So from there, I think we can go to the hormonal methods. Hormonal methods, we have the most common, you guys know it? P2, yeah. P2. Another one? P2, is it a method of family planning? It's an emergency pill. That one we'll talk about it at the end of it. It's not a method of family planning, but it's an emergency pill in that it prevents unwanted pregnancy. But you cannot use it as a method of family planning. Sawa? So mtu usinunue P2 na umeolewa. Don't. So the most common, the injection, yeah. Jadel, good. Coil. Yeah, now we are swimming. So I think the most common, which will, yeah?
What are the side effects?
I said we'll talk about it when we finish, because we don't group it as a method of family planning. We group it under emergency pills. Yeah. It only prevents unwanted pregnancy. It's not used as a method of family planning. So we can start with the IUCD. IUCD is a coil. It's T-shaped. I think tuko na moja huko, mtu anaweza tuletea tuonyeshe. So the IUCD is a small T-shaped plastic device that is inserted inside the uterus to prevent pregnancy. Ataleta tuione. It's a 2 centimeter rod, T-shaped. It's inserted inside the uterus of the females. And it works in that it produces what is called copper T ions. That is why it's called copper T cells. Ions. You remember the ions? When those ions are released inside the uterus, it means they are going to be hostile to the any sperms coming. Another way in which they prevent pregnancies, they also act as a barrier. The way it's put inside the uterus. If you know the anatomy of the uterus is let me just show you. The uterus normally looks like this. These are the fallopian tubes. So it's placed here. It is placed like this inside the uterus, touching the endometrium. Endometrium is the inside of the uterus. So when it touches this side and it touches this side, it means it's going to interfere with the endometrium wall. Therefore, implantation is not going to take place. So that is how it works. So these IUCDs, they are normally divided into two. We have the hormonal and we also have the non-hormonal. There are those IUCDs which use hormones and there are those which don't use. But nowadays we advocate we normally use the ones which don't have hormones. So ndio hii inafika hapa, si mnaona where it's blackish, hivyo ndio inatoshana. So this is the trocar. Hii ni ya kuingisha tu, but this is how it looks. So inawekwa, there's something called a speculum yenye inainsertiwa inside the vagina just to make it feasible, and then this thing is inserted inside the uterus. So mwanaume asikudanganye eti is feeling the string. This thing is put inside the uterus, tumbo ya mtoto. It's not put in the cervix. So what normally hangs outside the cervix, the cervical opening, is the string, and we normally trim it so that during the time of removal we just pull the string. When you pull the string, it's now T-shaped. It's like this, T-shaped. When you pull the string, it comes like this, so it falls off easily. And this procedure is not painful. It's just uncomfortable. You won't feel any pain, you just feel uncomfortable. So there are those rumors which go outside. There are females saying, oh, this thing is very painful. How do I open my legs? Yet you open for them. You come, do the thing, and then you'll be safe. Simba? Yeah. There's no need of bringing PPC to this world whom you cannot take care of. Yeah. So this one can last from 10 to 12 years. But you normally do what is called regular checkups. But the goodness with this one is that the moment you remove it, if you remove it today, next week you will be pregnant because it does not interfere with your hormones. So you can put it today, stay for 3 years, you remove it when you want to have pregnancy. Remember we said family planning is deciding to now have the number of babies you can comfortably take care of. So the advantages of this one is that it's very safe. Once you have it, failure rate is 1%, which means 1 in 100 women will get pregnant. So, but if you come for checkup, normally if you have been inserted this one, you come for checkup the next month. Then from there you come after 6 months. Then from there you come yearly. After every year you come for one checkup. Every year. It does not interfere with your hormone system. So you will be having your periods regularly. But for the first 3 months, there may be changes. There may be spotting. Spotting in ile, mnaelewa spotting female? Kidogo. I'm coming to the disadvantages. Yeah. So the advantages of this one is that it's very safe. It's not very expensive. You can afford it. It's reversible. It's long acting. You don't have to put this one if you want to be pregnant in the next three months. So, yeah, it's long acting and then it's very effective. Disadvantages is that it can cause heavy bleeding, especially for the first 3 months, because remember this is a foreign body inserted into your body. So there's the way the body responds to it. To some women, it may not cause. These disadvantages does not necessarily mean that they are going to cut across every woman. They are individualized. There are some who can have heavy bleeding, some don't experience heavy bleeding. It can cause PID. PID is an infection of the pelvis, meaning it can cause infection of the ovaries, of the cervix, but it does not cut across. Sometimes it can cause ectopic pregnancy. It also may come out if it's not properly inserted. Side effects to women is that it can cause amenorrhea. Amenorrhea is lack of menstruation. It can cause, normally, the one which normally causes amenorrhea is hormonal. I said there are two. The one for hormonal is the one which normally causes amenorrhea. It can also cause spotting. It can also cause abdominal pains, especially for the first 3 months. It can also cause headaches, and it can also cause acne, and it can also alter your mood. It can give a woman a depressed mood. What I can say about this is that as much as it has its own side effects, it's very effective and it's very available as long as you have been inserted with a qualified personnel and you come for checkup. So, another hormonal family planning method are the pills. Pills si mnazijua? Pills. These ones. There are types, kuna my choice, CP and your family plan. It depends with the type of hormones. We have progestin only pills, na kuna zingine ziko combined. So these ones normally ziko indicated. If you read here, if you are using pills also, one disadvantage is that you have to remember to take your pill. If it's at 7 every day and when the husband is away, the common mistake which happens is that if you have a boyfriend, or rather if you are married and you are using pills, and your husband decides to go for a seminar, that week you don't do what? Which is very risky. You don't take because he's not around. But remember this thing, they work like the normal body system. That's why they are designed from day 1 of your menstruation. That is when you start taking the pills, up to day 0. No, these ones understand. It should be taken daily, whether the husband is there or not. So hiyo staenda deep sana. The disadvantages with the pills is that if you have hypertension, that is why before you are given family planning methods, you come for checkup. So that if you have hypertension, you are advised against. If you have heart diseases, liver diseases, if you have tumors, then you are advised against, because these things are hormonal. Sawa, they are going to interfere with your system. If you also smoke, you need to see a healthcare practitioner before you decide on the family planning method. If you have cancer issues, if you are breastfeeding, there are drugs that are eliminated that we say they do what? They pass through milk. That medical term. So before you take these medications, not medication, I mean this family planning and your breastfeeding, you need to come and see a healthcare practitioner so that they decide for you if you are undecided. Depending on your history, he or she can advise you on the best method of family planning. If you have diabetes, you are also advised against. The advantage with this one is that it's very convenient to use as long as you remember to take the pill. The side effects is that it can cause dizziness, it can cause nausea, it can cause vaginal infection, it can also cause weight gain. There are women who can start this one after 6 months. She was 50, she now looks 60. That is why you need to come and be checked before you decide on the family planning method. I think now we'll move to the injection, that is depot. Depot is a method of family planning whereby it's an injection that contains progestin. Progestin is a hormone that is found in the body which inhibits ovulation. Inhibits inamaanisha it stops ovulation. So when you have this injection, then it means you are not going to get pregnant because you are not going to ovulate. So that is how it works as a method of family planning. It's normally given on the deltoid muscle, this one, hapa ndio unadunga, and it normally takes effect after every 90 days. That is why after every 3 months, you need to come for the injection. The accurate days according to the books is 84 days, but we normally count. After every 90 days, you come for the injection. We move now to implants. By inhibiting. Inhibiting in simple English is stopping ovulation. Yeah. That is why most of the women who have who use depot, they will tell you they have never seen their menses. Those are may roll because it inhibits ovulation. So, yeah. So another method of family planning is called an implant. This one is a small device that is inserted under the skin. Sijui kama tuko nayo hapa niwaonyeshe. It also contains progestin hormone, and the fact that it contains progestin hormone, it means therefore that it's going to prevent pregnancy by inhibiting ovulation. So I will show you. We normally have two. We have an implant that takes 3 years and an implant that takes 5 years. Like this one is an implant. Sijui kama tunaweza haribu moja, but I can show you. This is how it looks like. So when you come for insertion, that is when I can demonstrate how it's done, but it's normally inserted under the skin. The arm, the upper arm, normally we insert it on the medial side here so that the women are also comfortable putting on short sleeve without exposing the form of family planning they have done. So, yeah. So, before I move to the permanent method, I want to talk about the e-pills. The e-pills, we normally don't advocate for them as a method of family planning, but they are used to avoid unwanted pregnancy. Either you are raped, most often in rape cases, but as we don't use it in rape cases, you use it when you go to see your boyfriend and you had not planned to have sex. So you have sex and you pretend like you are raped. So you go for the P2. So, so these P2s, they normally work after 72 hours. They have high levels of progestin. That is why it's advocated that you only use a maximum of 4 P2s in a year. But the problem is you guys use those ones in a week or in a month. Yeah. So P2s are not very safe. With the continuous use, you will have a point where you will be having something called recurrent. Recurrent abortions. You want to get pregnant and you can't get pregnant. So, because your body has been used to eliminating. So that is why they are not safe, but to be used as a method of family planning, but they can be used to avoid unwanted pregnancy. So they are only indicated in case of unprotected sex, in case a condom ruptures, and in case there is sexual assault. That is when you are advised to use P2. And they only work within 72 hours of sex. So you come after 108 hours, it means you won't prevent that pregnancy. So they only work after 72 hours, meaning after 3 days. First 3 days, P2 can't work. So we move to the permanent methods of family planning. There are normally two, one for females, another one for males. For females, it's called tubectomy or tube ligation. This is where they cut a section of the tube, the fallopian tube, and to ligate ni kufunga. So what is normally done, if this is the fallopian tube, remember this is where fertilization takes place, and this is the pathway for the ova from the ovary to the uterus. So if this is the fallopian tube, they normally make small incisions on the abdomen, and they take a section of the fallopian tube like this, and they tie like this, which means the ova is not going to move from the other side to the uterus. So that is how it works. And it's a permanent method of family planning. It's only advocated if you are past menopause or you have had as many children as you want. But if you are young like me, I don't want to have another baby, but if I go for tube ligation, the doctors will not agree. Because just in case anything happens to your child, you will want to get pregnant again, and you will not be able. It's irreversible. Once it's cut, it's irreversible. It means you won't be pregnant. And for men, it's called vasectomy. Vasectomy, this is where small incision is made on each side of the scrotum. And the first difference is then cut and tied outward, blocking the passage of spermatozoa. This is for males, it's almost the same procedure. For males, they make a small incision in the scrotum, and they cut the sperm duct. The first difference is the sperm duct. The sperm duct is the one that brings the spermatozoa. The spermatozoa, in short, is sperms. And when it's cut, it means this man, remember, men can ejaculate without the spermatozoa. They can ejaculate semen, which means they will ejaculate, but they can't get you pregnant. So they will erect, they will do everything, but whatever contents they are pouring this time around don't contain spermatozoa. Those are the male sex, whatever. Yeah. Yeah, it's also a permanent method. It's normally advocated if you and your wife don't want to have babies. But normally this method, males in Africa are reluctant. Personally, I've never seen a man being done vasectomy, but just in case you care for your wife and you don't want any more child and you have decided, that is why I've said family planning really needs cooperation between you and your wife. Be it hormonal, be it non-hormonal, be it condom, because there are some males who say, I don't want to use a condom. And there are some females who will use these hormonal methods and they affect them. So if you don't talk, you'll get you two are a family and you are suffering. And you are getting kids whom you cannot be able to take care of. So knowledge is power, and it's power when you use it to your own advantage. Yeah. So I think I can stop there. I don't know whether there is one which I have not discussed, but those are the major. I think you've seen the condoms. You've seen these are the natural counting. These are the pills. This is the coil. Those are the 4 major types of family planning, unless there's a question. So I want you to ask any questions you have, any theories.
Actually,